Hello, good morning, everyone. So, today again, we are having a live session on Facebook. I'm Dr. Swati Rai, and today we'll be discussing about a very important topic. This month, April month, is a Cesarean Section Awareness Month. So, we have chosen this topic for today. We'll be discussing two different aspects. One is what is the pros and cons of vaginal delivery and a cesarean section. And in the second session, we'll be discussing how to prepare yourself for a cesarean section, what happens in a cesarean section, what post-op care you require, and later on. So now there are two modes of delivery, as we know. One is a natural birth, that is, in other words, like said as vaginal delivery, natural vaginal delivery, normal vaginal delivery, or a natural birth. The second is in some situations when there is risk to the mother or the baby, or some situations where the baby cannot come vaginally, then we have to go for a other route, that is cesarean section. So in that we cut the abdomen, uterus, take out the baby and stitch everything back. Now there should be a informed choice, in the sense, as a patient, as a delivering mother, you should know beforehand what is the benefit of a vaginal delivery, what are the difficulties or the disadvantages, as well as for the cesarean section. The concept of Cesarean Awareness Month is to reduce the unnecessary cesarean sections, because nowadays females are opting for an elective cesarean section, that is also known as cesarean delivery on maternal request. The mother is requesting, please get me a cesarean section. I do not want to have the labor pain and everything, but there is some difficulties later on that you can have because of this kind of an approach. So you should know both the things, weigh accordingly, and then can make an informed decision. So let us first discuss about the vaginal delivery. So vaginal delivery, what are the, first let's talk about what are the difficulties, and first let's talk about what are the advantages. First, there is a short hospital stay. After a vaginal delivery, you may be discharged within 24 hours or maximum 48 hours, not more than that. Less number of injections, less number of drugs are required for a vaginal delivery. It's basically a natural process. Sometimes we need to give, there are two types. One is you can go in labor naturally, or if you do not go in labor till 40 weeks, or there is some other medical disorders or any obstetric indication required, then we may induce you. Induce means induction of labor. We give some drugs, medicines, suppositories to increase that, to that augments and that, that induces labor. Sometimes you go in labor naturally, but the contractions are not very good, then we augment labor. So these are the different approaches. Now, there is quick recovery also. The very same day when you deliver a baby vaginally, you will pass urine, you will pass your motion also, and you will be up and about the very same day. You will be walking. Avoid, as well as it's not a major surgery, so there is no much risk associated, no surgical risk associated, no anesthetic risk associated. Nowadays there is a painless vaginal delivery also, बिना दर्द के normal delivery होना, जिसको बोलते हैं painless vaginal delivery. Actually we give an anesthesia in that, that's called epidural anesthesia, where you can have less of pain perception and you can deliver vaginally. Now, once you deliver vaginally, the baby is put on your abdomen at the very same time. So there is early contact with the baby. Now, there are many benefits because of that. What is, when there is early contact with the baby, the bonding between the mother and the baby increases. The breast milk supply also increases with that. The initiation of breast milk is very early in normal vaginal delivery, because the baby will be given to you immediately just after wiping, seeing all the vitals by the neonatologist, looking at the baby and examining, and then they will give you the baby. सो आपकी ब्रेस्ट फीडिंग जल्दी इनिशिएट होती है. बच्चे को आप जो फर्स्ट मिल्क होता है, जो कि बहुत ही बेनिफिशियल है, दैट इज कॉल्ड कोलोस्ट्रम. It has all the immunoglobulins in it. So that is given to the baby, and breast milk supply and initiation is also early. So there is early contact. Now, these are the benefits of the mother. Then there are benefits of the baby also. First, breastfeeding is initiated early. Second important thing is, as it is a natural process, so the baby goes through the vagina, and during that process the lungs, whatever fluids are there in the lungs, they get squeezed out. So there is expansion of the lungs once the baby is out. Now this is also very beneficial for the baby. There is less breathing problems, less neonatal ICU admission of these vaginally delivered babies, and there is less, one complication is there called tachypnea of newborn. So this is also less in vaginal deliveries. So these are the benefits. You will be discharged the very next day, and you'll be up and about. Not much antibiotic injections to be taken, and you can start your normal routine, and your recovery is also very early. But there are some cons also. Now, what are they? It's a very long process. It's a labor. That's why it's called labor. On a pain scale, that's called visual analog scale. If we point what is the intensity of a labor pain, it is from 1 to 10, it is 10. So it is no doubt very painful. The most painful process in the world. It is long taking, because for a preemie means the person, the female who has become pregnant for the first time, this labor, there is a latent phase and there is an active phase. Both the phases are very prolonged, even up till 18 hours. You can be in a latent phase, or 12 hours in a latent phase only, and you'll be having pain. And the active phase is also prolonged. So it is actually laboring. It is painful, especially for the first timers. Now, you are when you are delivering a baby, the cervix gets dilated till 10 centimeters, and then the baby passes through the vagina. So when the baby is passing through the vagina, some kind of tear injury is happening in the vaginal musculature. Sometimes we give a incision also, जो बोलते हैं छोटे ऑपरेशन से डिलीवरी हुई है बहुत लोग, that's called episiotomy. That incision is given. We repair that incision after the delivery, but still there is neural damage. There is जो muscles होते हैं, वहाँ के tissues होते हैं, वो सब में कुछ ना कुछ damage जरूर होता है. So later on, there is pelvic muscle weakness. These females are prone to have incontinence of urine, मतलब कि stress incontinence. जैसे अगर आप खांसी कर रहे हो, आपने देखा होगा 50 years 60 years पे females में चीजें develop होती है जिनकी पहले बहुत deliveries हुई थी. What they have when they are laughing, coughing, so they can have some dribbling of urine. So this is called incontinence. There can be rectal incontinence also. So bowel bladder problems आ जाती हैं. Prolapse हो सकता है, पूरी बच्चेदानी भी बाहर आ सकती है जिनकी पहले दाई कंडक्टेड डिलीवरीज हैं या फिर डिफिकल्ट डिलीवरीज हैं, बहुत सारी डिलीवरीज हैं. एंड जो पेल्विक muscle exercises बोली जाती है डिलीवरी के बाद, that's called Kegels exercises. They have not practiced that. So there is high incidence of prolapse also. Now sometimes even if you're not having anything, but there is a constant, because जो episiotomy दी जाती है वहाँ पे stitch होता है, वहाँ पे एक knot दी जाती है, एक constant dragging pain बहुत लोगों को बहुत टाइम तक रहता है. So it is normal if you're having it. It can be present. Other thing is birthing injury. दैट मीन्स बच्चे को भी कभी कभी अगर डिफिकल्ट डिलीवरी हो रही है तो बच्चे को भी कभी कभी इंजरी हो सकती है. कुछ केसेस में इंस्ट्रूमेंटल डिलीवरी की जरूरत होती है, हमें कुछ इंस्ट्रूमेंट्स लगाने पड़ते हैं लाइक फॉरसेप्स और वैक्यूम. उस कंडीशन में देयर कैन बी डिफिकल्टी फॉर बोथ द मदर एंड द बेबी. बच्चे को भी दिक्कत आ सकती है और मदर को भी दिक्कत आ सकती है. सो दिस इज ऑल अबाउट वजाइनल डिलीवरी. Now let's talk about cesarean section, C-section, lower segment cesarean section. These are the different name given to it. So when we talk, there are some, one is you are requesting your gynecologist for a cesarean section. So that is something that should not be promoted because it is a major surgery. And later on also your obstetric profile changes after getting one cesarean section. But there are some indications where we need to do cesarean section to save the life of the mother, to save the life of the baby. The baby is, you planned for a normal vaginal delivery, everything was going fine, but the labor is becoming prolonged. The cervix is not getting dilated properly. There is non-progress of labor. बच्चे का heart rate कम होने लग जा रहा है. बच्चा distress में जा रहा है. So there are many indications where we actually have to opt for cesarean section only, and it is a life-saving procedure for both the mother and the baby in those conditions. So first, let's talk about what are the pros. It's very quick. You can plan it. You can electively plan it that, ma'am, I want this cesarean to be done. Like if there is an indication for cesarean, you can plan it accordingly after 39 weeks. Yes, ma'am, I need to, please get it done on this day. So you can plan it. It can be managed well. It is short time taking. Within 45 minutes, the cesarean section will be completed in and out. There is no risk associated to the pelvic floor because vaginal delivery is not occurring, so pelvic floor touch ही नहीं होता है. The baby is taken out from the abdomen, so there is no injury to the pelvic floor. कोई incontinence की problem या कोई prolapse की problem बहुत ही कम होती है. Rarely in cesarean section patients. It is planned, it is scheduled. Nowadays people are getting Muhurat cesarean also. It's very much predictable until and unless there are much risk factors associated with it. And most importantly, life-saving for the mother and fetus in some situations. But there are a lot of cons associated. It is a major surgery. It is one of the major abdominal surgeries. So all the risk associated with a major surgery, anesthesia related, you may require blood. Blood loss is more in cesarean as compared to vaginal delivery. Then during cesarean section, because वहीं पे bladder होता है, वहीं पे bowel होती है, so there can be injury to bowel and bladder. If there is a previous cesarean section, आपकी पहले कोई surgeries हुई हैं, फिर दोबारा आपकी अब surgery हो रही है, तो उसके अंदर और chances होते हैं because adhesions, चिपकाहट होती है abdomen के अंदर, so there is high chances of injury to bowel, bladder, intestine and everything. Then all the surgical site infections risk are there in cesarean section. That means जो हम incision दे रहे हैं abdomen पे, उसके अंदर भी infection होने का risk होता है, overall infection होने का risk होता है. So these are something that is associated. Second is the pain and discomfort. As you are getting a major surgery, आपका पूरा abdomen around 8 to 10 centimeter का एक incision होता है. Now when we suture it, it is very painful. And actually there is some neural injury also that occurs inside. So the recovery it takes a lot of time. In a vaginal delivery, the patient recovers within 3 weeks, 2 to 3 weeks, maximum 6 weeks. But in a cesarean section, a patient will recover in 2 months, maybe 3 months. Some people do have a residual pain on one side up till 6 months. Scar प्रेगनेंसी, जब आपका सिजेरियन हुआ है, आपका रिकवरी पीरियड भी ज़्यादा टाइम लगता है. नॉर्मल डिलीवरी में आप 24 आवर्स में डिस्चार्ज हो जाते हो, बट सिजेरियन में वी कीप यू फॉर 3 days एंड वी डिस्चार्ज यू आफ्टर 3 days. कैथेटर इज गिवन, दैट इज जो नली लगती है ब्लैडर के अंदर, उसको भी हम अगले दिन निकालते हैं. सो यू आर पासिंग यूरिन ऑल्सो द वेरी नेक्स्ट डे. The baby is not given to you the same time. Sometimes the baby is in the NICU और बच्चा आपको थोड़ा लेट मिलता है, तो बच्चे से बॉन्डिंग थोड़ी लेट होती है, अटैचमेंट थोड़ी लेट होती है. एंड मोस्ट इम्पॉर्टेंटली द ब्रेस्ट मिल्क. It is very common that cesarean section females have a little later the breast milk production. So the milk letdown reflex is a little late in cesarean section females, maybe by day 2 or day 3. So that early breastfeeding cannot be associated in them. And one more thing is, there was a concept previously, once a cesarean always a cesarean. That means अगर आपका पहला बच्चा cesarean से हुआ है तो दूसरा बच्चा cesarean से ही होना है. लेकिन आजकल नहीं, it's been very long, we have a concept of VBAC. VBAC is vaginal birth after cesarean section. So if everything is normal, there is a chance that you can deliver vaginally. We do promote vaginal birth after cesarean. That means आप vaginally deliver कर जाएं. We call it a trial of labor. We try that. But there is always a chance, always a risk of scar rupture. एक scar है uterus के अंदर जो कभी भी rupture कर सकता है. Plus spacing is very important. अगर आपका पहला बच्चा cesarean से हुआ है तो दूसरे बच्चे में कम से कम आपको 3 साल का फर्क रखना है. short interconception period, matlab short period between your two pregnancies is not advised. So these are something that you have to always keep in mind when you're opting electively by your discretion that, ma'am, no, I want to get a cesarean section done. Second thing is for the baby also, as I told you, in vaginal birth जितने भी lungs के fluid होते हैं, क्योंकि compression होता है, वो अपने आप निकल जाते हैं, जो कि cesarean section में नहीं होता है, because it's not a natural birthing process. So there is a chance of something called transient tachypnea of newborn. बच्चे के अंदर breathing problems cesarean section babies में common होती है. There is a high chance they can have breathing problem. But as I told you previously, certain situations, this is the only life-saving process for the mother and fetus. So whenever during your antenatal period, we generally by 37, 38 weeks, we do a pelvic assessment and plan accordingly that you can deliver vaginally. Or if there is some high risk factor, you may need to deliver by cesarean section. Discuss with your gynecologist why we are opting for this procedure and what are the benefits, what are the disadvantages, and then make an informed decision. As a gynecologist, as a mother also, the aim is that we have to deliver a healthy baby to a healthy mother. So thank you very much. And if you have any queries, any questions related to this aspect, you can put it in the comment box and we'll like to address them in our next session. Thank you.